Do you suffer from arthritis? It can be an uncomfortable and such a painful condition, and it can be made so much worse by being overweight. I mean, think about it. Your joints have to support your body. If your body is heavy, then your joints get more wear and tear. In this video, I want to share with you some insights into the link between body weight and arthritis, and I want to show you how you can make simple shifts in your lifestyle that lead to dramatic shifts in your overall health and well-being. Arthritis literally means joint pain, and it's caused by inflammation in the joint. It's developed from a few different causes, like autoimmune diseases, where the body is attacking the joint, overuse, wear and tear, or as a result of some type of infections. Research shows that osteoarthritis, I'm going to call it OA from here on out specifically, is more prevalent and worse in those carrying excess fat weight. Overweight women are 4 times as more likely to have OA in the knees, and overweight men 5 times more likely. And in one study, they showed a decrease of risk of OA by 50% for every 11 pounds dropped. I mean, that's huge, and I think it's so exciting because we can significantly reduce the risk and pain associated with OA by dropping the excess fat weight. It's actually interesting that it's not quite clear why rates of OA are higher in overweight and obese individuals. It's clear that more weight equals more force pushing through the back and the lower extremities, so that could speed the breakdown of cartilage in the joints and, more wear and tear. But research also shows increased rates of OA in the hands of overweight individuals, which actually suggests a possible systemic impact as well. For a lot of people, weight loss, especially when following a low-inflammatory diet, can significantly reduce and even eliminate your joint pain. Isn't that crazy? Especially in the ankles, the knees, hips, your lower back, and this works through 3 ways that I want to share with you. The first way is by shifting your nutrition. By eliminating some foods and highlighting others, you can actually significantly reduce the inflammation in your body. Wheat, for example, for a lot of folks, triggers inflammation in the body and can cause terrible joint pain. I have a client, Trisha, and she's been with me for a few years and came in and just had wicked pain all over her body. And we knew that dropping weight was going to help reduce the pain that she had. But what we did was we played with the different foods that cause inflammation, specifically wheat and nightshades like potatoes, bell peppers, tomatoes. Those are some examples. And we took those out of her diet, and within 1 week, the majority of her pain was gone. And we knew that was not from the weight loss specifically, but primarily from shifting the foods that she ate. Number 2 is by getting rid of this visceral fat, this belly fat, which I talk about in a lot of my other videos, so make sure you subscribe below. But remember, these fat cells in the belly are active. They secrete all of these different hormones that encourage cravings and hunger and a slow metabolism and make you not want to move. They make you lazy. But one of the hormones that they secrete is called interleukin 6. And interleukin 6 is this major inflammatory hormone. You can take all the pain pills in the world. It's not going to influence what naturally is being secreted in your body. So we want to make sure that those inflammatory hormones secreted by your own self are as low as possible. And the biggest way you can do this is by dropping the weight and getting rid of the belly fat. And number 3, by reducing the amount of force pushing through the joints. Did you know that for every 1 pound of excess fat weight that you carry, it's 8 pounds of force pushing through your foot and ankle? Every 1 pound that you carry is about 6 pounds of force pushing through the knee. And for every pound of fat that you carry in the belly and the chest, it's about 4 pounds of force pulling off of those joints. So if those joints are already inflamed and you've got that amount of force pushing off it, oh my gosh, it is so significant. So by dropping that excess fat weight and the amount of force being pushed through the joints, most people experience a dramatic relief from long-standing arthritic joint pain. We had a client, Billy, and he was referred in to us by his orthopedic surgeon. And he had gone into his orthopedic surgeon to ask for surgery for his right knee due to arthritic pain. And his ortho doc, he had seen great results from other patients he had referred in to us. And so he sent Billy in to see us first because he wanted Billy to avoid surgery, which I think is great. And it is so amazing, but after 6 weeks of being on the program, Billy had dropped 18 pounds. He eliminated sugar from his diet with no cravings and no hunger. It felt great. It wasn't a painful experience. and he only had a small bit of pain left in his right knee at night that after 2 more weeks went away completely. Now he's up, he's moving a lot throughout the day. He is so grateful that he was able to make these changes without surgical intervention. The difference in joint pain from before and after losing weight, especially with a low-inflammatory diet, is life-changing. Through hitting the 3 different ways, reducing inflammation from food, reducing inflammation from dropping that belly fat, and by reducing the amount of pressure pushing through your joints, arthritic pain can be significantly reduced to completely eliminated for most people. We solve these issues all the time, and we help people in pain every day. If this is you, click the link below and we'll schedule a call with one of our nutritionists. We know we can help you make a change. Now that you've seen the difference for yourself, do you think weight loss can have an impact? Yes, right? It can. So the next step should be to find the right way to lose weight. You probably start to think immediately about strict diets and letting go of your favorite foods. If you're watching this video and you're eating a donut, I'm gonna tell you to put it down. But most of the time, small behavioral changes really help. In this video, I want to guide you through some of the lifestyle adjustments you can start to implement yourself. I promise you, you'll be so surprised by the awesome results. Let's dive into the subject. See you there.